I'm gonna get dizzy with this.
Yeah, and then once you show the whole room good like this, then the next 2 scans you can just kind of do a quick turnaround.
I'm already scanning.
Yeah, I know.
Oh, okay. She left her mess there. Okay.
Okay.
Making her way.
And then just make sure that you get like a close up of me doing all the punctures and stuff.
Okay. I think we're good.
Okay, so I'm gonna start now. So before I enter the room, I'm gonna go ahead and check the patient's chart, check everything we're doing, gather all the supplies I need. I already have it gathered over there. Okay, I'm gonna go ahead, enter in the room, knock, enter, close the door, introduce myself. Hi, I'm Hailey. I'm going to be your nurse today. Can you please tell me your name and date of birth? Great, thank you. I'm just gonna double check your wristband and confirm that it is in fact Barbara. Hi Barbara, how are you doing this morning? Good. Okay, I'm gonna go ahead and wash my hands here quick, and I'm gonna explain to you what we're doing today. So today we're going to be getting a blood draw from you, starting in an IV, and then we're going to be saline locking your IV. We're gonna be discontinuing your IV, and then on your CVAD that you have up on your chest, your central line here, I'm going to be changing your dressing on it and collecting a blood sample from it. Does that all sound okay? Yes, great. Now, do you have any allergies to anything at all that I should be made aware of? No? Okay, great. And I have permission to go ahead and take your vital signs before we begin. Yes? Okay, great. So I'm going to go ahead and do that. So I'm going to come, perform hand hygiene once again, take my gloves. We only have 1 set of gloves, so I'm just going to be verbalizing when I'll change them and stuff. But I washed my hands. I'm gonna go ahead and put the gloves on. And we're going to be starting Barbara first with a blood draw from a butterfly needle, okay? I'm just gonna move my wipes out of the way. I'm going to go ahead and gather up all the supplies I need and get it ready. This. Get some tape ready. My gauze are ready. What's ready? Okay, so we're gonna have that sitting there already. Okay, Barbara, I'm gonna make sure that you're all pumped up nice and good. Okay, now before I begin this, I'm just gonna go ahead and assess the arm, make sure that it all looks okay. Everything, the arm looks good, nothing abnormal with it. Okay, Barbara, I'm gonna go ahead and take this tourniquet and tie it tightly around your upper arm up here. Okay, so I'm going to tie the tourniquet tight, make sure I can get it. I'm gonna look for any veins that I want, and I'm gonna make sure that I can palpate them. Just because I can see them doesn't mean that I can palpate them. So I'm gonna find the vein I like, and I like this vein right here. So I'm gonna be using this vein here. So I'm going to go ahead and take this sterile pad, open, I'm gonna make this my little garbage area here. I'm gonna throw that in the garbage. I'm going to go ahead and clean Barbara's vein quick. Okay, we're gonna clean that for 30 seconds, let that dry. And then I'm going to take my butterfly needle here. I'm going to set it up and have it ready. I'm going to unclasp it, make sure I have the bevel up. which I do. So now I'm going to go ahead and pull the skin taut where I want it. And I'm gonna go ahead and insert in at a 15, 30-degree angle and go until I get flashback. And there I have flashback in it, so I'm gonna go ahead and pull her tourniquet and take it off. I'm gonna go ahead and keep inserting in all the way. So now I have it, I'm going to stabilize it in there. I'm going to take this and I'm going to go ahead and push it in while I'm still stabilizing the needle into Barbara's arm. I'm gonna push it in and get some blood return. And I'm gonna get the amount that the provider requests. Okay, so that's the correct amount that we need. So I'm gonna take it off. I'm going to go ahead and hand this to Lab, who's also in the room with me, and they're going to take it and do what they need with it. So now that I'm still stabilizing this, I'm going to take my gauze. I'm going to hold my gauze over top of the needle here and still stabilizing it. I'm going to pull it out all the way, discard it in the sharps receptacle, take my tape and tape it over onto Barbara. How are you feeling, Barbara? Are you feeling good? Yes? Okay, great. So now we're done with the venipuncture and we've obtained our sample. So I'm going to remove this here, and I'm gonna pump it up again. Okay, Barbara, so now we're gonna go ahead and move forward with starting your IV access site. Does that sound okay? Okay, great. So I'm gonna go ahead and just get everything I need ready and open, and between these things I would have disposed of my gloves, washed my hands, hand hygiene, and put on new gloves now. So these are new gloves. So I'm gonna go ahead and open all of my supplies up. I'm going to discard of this tourniquet because I already have a tourniquet on. I'm just going to remove all of this. Then my flush. Dispose of that. Open up my extension tubing. And we're going to be saline locking this access site once we get it inserted into your arm. Okay, Barbara? Okay, great. So now I'm going to take this and I'm going to go ahead and flush it here quick. So I'm going to uncap my saline. I'm going to screw it in here and make sure that it's not clamped. And I'm gonna push some saline through, and I want to see saline come out like this. Check, make sure there's no air bubbles. There is not. I'm just going to loosen the cap a little bit so that way when it comes time to take it off, I can take it off easier. So I have that. So I have that sitting here. Okay, I'm gonna take my Tegaderm. I'm going to make sure that is opened up, setting out. I'm going to get my tape ready. Go. Okay, Barbara, I'm gonna go ahead and reapply this tourniquet to your arm. Make sure it's nice and tight so that we can see a vein. I'm going to break this alcohol thing and I'm going to palpate for a vein and see which one I like. And I think I'm going to be using this vein right here today. So I'm gonna go ahead and clean it well. I'm gonna clean it for 30 seconds and then wait until that is dry. And I forgot to grab my IV needle, so I'm gonna grab that out of my supplies. Forgot it's not in the bag. I've got it here. Cindy gave me more. Okay. So now that I have my needle and the arm is nice and dry, I'm going to go ahead and open it up. Just getting rid of it. Okay, so I have my skin here. So I'm just gonna go ahead and pull it taut and stabilize the vein. And then with the bevel up, I'm going to go until I get flashback, going at 10 to 15 degrees. So there I have flashback. So I'm just gonna go in a little bit more. And then I'm going to, this person is going to bleed a lot, but I'm going to press, on a normal person, I press down here at the end of the vein, retract, and he's gonna start bleeding. So then I'm going to take this off here. I would still be stabilizing right here. I'm going to attach it like so, and I'm gonna flush the catheter all the way in to the arm while stabilizing it. So we're just going to flush all the way into the arm. So I'm going to pull back and aspirate, make sure I have blood return, and I do. I'm gonna make sure I get out any air bubbles that I can see, such as those, get them out of the line. Okay, I'm going to go ahead and lock my flush here. So now I'm going to take my tegaderm and still stabilizing it. I'm gonna make sure I apply it right here at the hub and get it nice and tight right here. Oh, I don't have a pen either. Okay, I'm going to take off this outer barrier here. Make sure that it's sticking nicely. Okay, and then I'm going to grab a pen for my supplies here too. I'm going to take my pen and I'm going to go ahead and I would have removed the tourniquet as soon as I'd entered in the needle into the arm. Otherwise I would have burst it. I'm going to initial, date, and put the time here. And I'm going to take this off and make sure I can put it where it's visible on the arm. Right there. Okay, I'm going to go ahead and take another piece of tape here. I'm going to disconnect my flush. I'm going to put this into U, and I'm going to tape it down to the client's arm right there. Okay, Barbara, how are you feeling? Are you feeling okay? Yes? Great, okay. So we've successfully started an IV access point and we've saline locked it. I'll remove the tourniquet, and now I'm going to go ahead and discontinue it. I'm going to wash my hands, dispose my glove, wash my hands, put on new gloves. So these are clean gloves right now. Okay, Barbara, we're going to go ahead and discontinue it. So I'm going to go ahead and remove this tape right here and dispose of this in the trash. Off my fingers. Stabilizing the hub of the access point, I'm going to go ahead and pull up the tegaderm and pulling away from it. I'm going to go ahead and pull it all the way off, dispose of that. So now I'm going to take my gauze here and I'm gonna place it over top and I'm gonna pull it out all at once. So we're gonna go 1, 2, 3, Barbara. Pull it out, dispose of this, proper receptacle, but I'm going to keep it for now, but I would dispose of it. And I'm going to take my tape. I'm going to tape it on to Barbara's arm. There you go, Barbara. We've discontinued everything. You still feeling okay? Yes? And when I took it out, before I had taken it out, I had assessed the skin, make sure there's no redness, like make sure that nothing from what had been going in through the IV point had infused into the tissues around it, not into the vein itself, and everything all looked good. Okay, so we're done with this, Barbara. So now we're gonna move on to your central line. Is that okay? Yes, great. So I'm gonna go ahead, let the air out of your arm, and move your arm.
Do you want me to scan the room again?
Yeah. Okay. So now, Barbara, we're going to go ahead and we're going to move on to changing the dressings here for your central line, okay? So I'm going to go ahead and perform hand hygiene and put on new gloves. Now this will be a sterile procedure, so I'm going to remind you about that, and for that I'm going to go ahead and put on a mask of my own here, and then I'm going to give you a second mask. We couldn't find a second mask, but I'm giving Barbara a second mask to put over her face, and I'm asking her to turn her head away from her incision site over here, so that way it doesn't get contaminated. Okay, so now I'm going to take an alcohol, like adhesive swab thing, and I'm going to go ahead and rub it all over the tegaderm and dispose of it. And now, stabilizing it here where I can, I'm going to go ahead and pull up and away from the site while stabilizing it. There we go. And I'm going to go ahead and dispose of this. And now, taking my measuring ruler, I'm going to measure in centimeters from where it's inserted into the skin down to the hub here. So we're going to measure it, and it looks like it is about 15 centimeters. And I'm going to check the documentation from previously and make sure that it hasn't moved at all. And it hasn't. It was at 15 centimeters last time it was measured, so it all looks good. There's no redness, no drainage, nothing out coming from it. It all looks good. Okay, Barbara, so now I'm going to go ahead and remove my gloves without getting them all stuck, because I have to use them again. Okay, so I have those set aside. I'm going to go ahead and wash my hands, and I'm going to set up my sterile field here. So I'm going to take my sterile gloves, I'm going to open them up, and before I do that, I'm going to go ahead and open up my package here that contains all my sterile supplies. So I'm going to open it up. Move that out of the way. Okay. So I'm going to go ahead and open my sterile gloves while touching only 1 inch inside the border. Go. Okay, so I'm going to go ahead and pick up my glove here. And I'm going to go ahead and put it on as best I can. Okay, so these rolled like this, so I'm going to go ahead and dispose of these and get a new set of gloves and a new set of sterile supplies here and start over, but we don't have new sterile gloves, so I'm just going to do that again. Okay, so I have my new sterile gloves here, so I'm going to go ahead and open them. Okay, like this. I'm going to pick it up without touching the sterile field. Going to put it on.
Are these your size?
I have no idea.
Do you want to use mine? They rip?
Yeah.
Okay.
That's why I restarted them, because they ripped.
I'm gonna get.
America's letting me use her
So I'm going into my bag.
good gloves. Those ones
Gonna grab
keep ripping on me.
stick gloves. I think they're here in this bag. The second one.
These?
Yeah.
Okay. So I'm going to be using these gloves instead because the other ones ripped on me again. Okay, so I got new gloves, new sterile supplies. I've opened it. I've washed my hands. I'm going to open up my sterile gloves now. Dispose of this. Okay, I'm going to make sure I'm opening them and maintaining their sterileness. There you go. Okay, I'm going to go ahead and pick it up. I'm going to go ahead. I freaking hate sterile gloves. And insert them. Now I'm going to use them to put on a new set of gloves. Okay, I'm just going to rearrange them now. Okay, so this is sterile and this is sterile. So I'm just going to go ahead and move some stuff over. So I know what I have to work with. There we go. Okay. So now I'm going to go ahead and take my tweezers and I'm going to take this swab that has iodine on it. I'm going to take this. I'm going to pick this up with them. Okay. Okay. This is not working, but I'm going to go ahead and clean all the way around here. Maintaining sterile field, so it's all clean. So now I'm going to dispose of these over here. Okay, so that is all clean. I'd go ahead and clean with the other antiseptic wipe that we have. Some of the kids have another iodine thing, so I'm just going to go ahead and clean with this and dispose of it. I'm going to get my little gauze supply here, and I'm going to go ahead and maintaining being sterile, I'm going to go ahead and push it on here without touching the person, without touching Barbara. And it's not provided, but I'd also take our stabilizer that's impregnated with antimicrobial stuff, and I'd put it over top of that too. We just weren't provided it. I'm going to take my Tegaderm here, and I'm going to go ahead and open it. So I'm going to go ahead and take this, And I'm going to place it right about here to where I'm covering the whole bandage and as far down to the clamp as I can. I'm actually going to apply it this way. So I'm going to go ahead and apply it and press it down. Make sure that it sticks down really well. And I'm going to take this. I'm going to go ahead, peel it. My hands are no longer sterile. I'm going to go up and make sure that it stays down all the way. There we go. Okay, I'm going to initial it, date it, and time it. Okay. I'm going to go ahead and remove this, place it on here where it can be seen. How are you feeling, Barbara? Are you okay? Yes? Okay, great. So now I'm going to go ahead and dispose of all of this. And then I remove my gloves, wash my hands, and put on new gloves, but we're down on gloves, so I'm just gonna pretend these are new, clean gloves, not sterile. So all of this is in the trash, new clean gloves on. Okay, Barbara, we're gonna go ahead and get a blood draw from you now, okay? So I'm just gonna get all of my supplies that I need right here out in front of me. Okay, Barbara. So first, I'm gonna get my supplies ready. So I've got a flush here. I've got my cap ready, my 2 syringes. So first thing I'm gonna do is I'm gonna go ahead and pull back 5 milliliters of blood and dispose of that because we don't need it. And then I'm gonna pull back the doctor's order of blood and hand that off to lab. And then I'm gonna go ahead and flush it. So first, I'm going to take an alcohol swab and I'm going to clean it up. Clean it all, okay? And then I'm going to take my first syringe here. I'm going to screw it on. Feeling okay, Barbara? Okay, great. I'm going to unclamp and I'm going to remove 5 milliliters of blood. I'm going to clamp it again, remove it. So I've got 5 milliliters that I'm going to dispose of per the facility's protocols. Okay, I'm going to take a swab again. I'm going to clean it once again. And now I'm going to remove 6 milliliters because that's the doctor's orders. So I'm going to go ahead and remove 6 milliliters now, Barbara, once I unclamp it again. So there, clamp, and I'm going to twist the whole cap off with it. And I'm going to hand this off to lab, who's in the room with me, and they're gonna go ahead and do what they need to do with it. Okay, so now I have a new cap here. I have a new cap that I'm gonna take out. And I'm gonna go ahead and put on. Okay, so a new cap that I'm gonna go ahead and put on. Go. I'm going to take a wipe. I'm going to clean it. I'm going to take my flush here. I'm going to unclamp it. I'm going to screw in my flush, and I'm just going to flush 10 milliliters through. Okay, I'm going to unclamp that. I'm going to take a new alcohol wipe. Going to wipe it once again. Make sure that it's clean. I'm going to take my green swab here. I'm going to twist it on. Okay, Barbara, we're all done today with your IVs and getting your blood draws and changing all of your bandages, okay? How are you feeling? Feeling good? Okay, great. I'm going to go ahead and dispose of this and wash my hands. Okay, Barbara, are you still feeling okay? Everything's good? Yes, she's had no reactions at all. I can take off my mask now. Okay, Barbara, I'm gonna go ahead and give you your call light and make sure that you're comfortable. Bed's lowered to lowest position, has everything she needs. And I'm going to go ahead and document per the facility's protocols, and then I'd go ahead